Now we'll quickly run up to the next pediatric question. Now for the next pediatric questions, we are asked to discuss 4 disease conditions. Now these 4 disease conditions are not just general discussions, but only the clinical signs. You should talk about it, just list. So the full question, they said, list 5 clinical signs of the following. You should list the clinical signs of nephrotic syndrome. You should list the clinical signs of lobar pneumonia. You should list the clinical signs of acute osteomyelitis. You should list the clinical signs of rheumatic, that's acute rheumatic fever. So let's quickly move through them quickly. So this nephrotic syndrome, I have the picture displayed on the screen. Okay, so it's just a generalized edema. Okay, sorry, well, now talking about the signs. So you see generalized edema, the person will have swollen eyes, swollen face, swollen extremities, and all of that. Proteinuria, so the person is passing out what proteins in urine because what the glomerular basement membrane has been breached. So hypoalbuminemia, so because you are passing out proteins in urine, the protein left back in your body is decreased. Hyperlipidemia, okay, so lipid levels are actually going up. Pallor, and you're actually weak to infections. You can easily get infections. Now, what are the clinical signs of lobar pneumonia? High fever with chills, productive cough, pleuritic chest x-rays, bronchial breath sounds, and crepitations. Then tachypnea, you're having a difficulty in breathing, okay, and there's indrawing of the chest walls. You understand that kind of thing. So then acute osteomyelitis now. So there's localized bone pain and tenderness. There's swelling, warmth, redness over the affected bone. There's fever and systemic signs of infections. Okay, so there's reduced movement of the affected limb. Of course, you're not using that leg like you used to use it before. Then leukocytosis and raised inflammatory markers. That's if you check it on lab results, you see that white blood cells are actually going up and there's signs of inflammations there. Okay. Then lastly, we'll talk about acute rheumatic fever. So for the acute rheumatic fever, you see migratory polyarthritis. Migratory polyarthritis means today you are having problems with this joint. Tomorrow you jump to this joint. Tomorrow you join to the jump on the leg. Okay, so it's migrating. Then carditis, that's inflammation of the heart, giving you tachypnea, murmurs, cardiomegaly, heart failure signs. Then Sydenham chorea, that's when you're having those involuntary movements and all of that. Then subcutaneous nodules. Then edema marginatum. Okay, edema marginatum. So that's what we have for these 4 disease conditions, talking about their clinical signs.